What's up, everybody? Thank you guys for tuning in. We're so honored that you chose to sit with us tonight. We have such a very special guest, and we can't wait for you to hear this doctor, this young lady that's coming on with us. We're excited to have her. So, you are tuned in to Men's Health Community Connections podcast. It is presented to you by Advocate Aurora Health.
I'm your host, Chad Roper, along with my brother Mario J. Brown. Health issues continue to plague our community. When I say our community, I mean communities of color. And what we're going to do today is shine light on those issues.
Yes, for sure. So my host and I, as male leaders in the community of color, we understand that we're now taking responsibility to help educate our community on men's health using the platforms that we've both built for over 25 plus years in the music entertainment industry.
And we recognize our influence, and we have partnered with Aurora, Advocate Aurora, healthcare professionals to bring such educational and informational pieces of work to help the communities of color with these issues.
Absolutely. So without further ado, joining us today is Dr. Kiana Taylor-Coleman. Let me just bring her up real quick. Dr. Coleman, thank you so much for joining us this evening. We truly appreciate your time. How are you tonight?
Pretty good. Thank you guys for having me. This is something I'm very passionate about, and I'm just grateful to have the opportunity to just kind of chit chat with you guys about this topic.
Yeah, absolutely, absolutely. And so we know you live a very busy and fulfilling life, so we won't keep you long, but we definitely want to just get some gems and valuable information that you may want to share with our viewers today, especially related to men's health. And so can you just start off by just telling us who you are and kind of how did you get to where you are? Just a little bit about your journey. Just share it with us, please.
Oh, my journey is interesting. Well, not that much, but so born and raised here in Milwaukee, kind of know some of the needs of the community, having been a product of the community. So wanted to come full circle and find my way back to help out the community, specifically on health topics. But before I got here, I was a teacher for 6 years. And then I decided that, medicine, that's kind of where my passion lies. So med school, and here I am. So I'm very appreciative.
So
Wow. So
what high school did you go to? You said you're from Milwaukee. What high school did you attend?
I am a Riverside University High School alum. Go Tigers.
One of our rivals. I went to King, so we definitely were rivals back in the
I
day.
know. My brother went to King. It was a little rivalry in our house. So
we did a lot more. We did a lot more winning than y'all did back in my day. But I don't know about your day. But I know back in my day we did all the winning.
In basketball, yeah. Football, I think we had it on lock. So
100%. I totally agree with you on that one. Baseball, we had it on lock. So it's all good. See, there we go. We got some things in common.
Yeah.
So in your journey, through medical school, what made you take this particular route, like family medicine? What made you go that route as opposed to, you could have been an OBGYN, you could have been a pediatric doctor. What made you choose this specific field?
Family medicine allows me to be more broad. So
Okay.
I get to still do all those things. So I get to still deliver babies, but as a family medicine physician, I can see the whole family. So I can see the men as well as the kids, as well as our older, more wise geriatric patients. So it lets me, I feel like I can affect more of a change if I can get the whole family. Because you can talk to one person, but at the same time, if you're talking to a group of people that live in the same home, I feel like you're more effective to make a change because everybody's hearing the same thing from a doctor.
Right. I got a quick question on that. So you're able to basically get a child or a young adult, I'll say it that way, and you're able to take them to their their later years, I should say.
Yeah. Our little acronym is from the womb, so pregnancy to the tomb.
Got you.
wow. That's interesting. So, C-Note and I, we both have been in the music and entertainment business for over 25 plus years. It's something that we're both passionate about. And so it was kind of a journey that chose us. It's not something that we particularly chose, but it's just a gift that we had. And so with your field, what is the most rewarding and fulfilling thing about your profession? And is this something that you kind of always knew? I know you said you started out teaching, but was this kind of in the background?
Always in the background, yes. So didn't get into medical school directly after undergrad, but I needed to do something that was still going to uplift the community. And what better way of doing that if I'm not in medical school than to be able to educate our youth who,
Mhm.
you know, you learn. You have to,
Right.
like, you develop things and you learn a lot from your teachers. But ultimately, healthcare was my passion. One of the things that I find most rewarding, just within healthcare, is when you're able to see those changes and progress that's made. And don't get me wrong, with family medicine, it's not one visit. It's not a quick visit like an urgent care visit. You have a cut, we can stitch it up. This is things that takes time. And so when you can see that someone gets their diabetes under control or get their hypertension under control, whether it's with medication or if it's with lifestyle changes, I get excited with my patients. I congratulate them and I feel like it's a shared victory, but ultimately it's their victory because it's their health. So that's one of the things that I find most rewarding.
Yeah.
Now, in mentioning and talking about that, what do you think medicine? Let me ask it this way: which one? Let's say diabetes. Is it medicine that helps more, or food, or hypertension? Is it food, change of diet, or change or medication? Which one norm, or does it vary depending on the patient?
I say it varies depending on the patient. Because I know the effects that hypertension and diabetes can have on health, the long-term side effects. I present all the options, and with the patient together, we figure out what's the right path for them. Sometimes I'm a little bit more aggressive. I say, all right, I know that, you can't put these chips down. So let's start this medication. Let's work on the lifestyle changes. And then as time goes, we can gradually come down off the medication. And this could be solely lifestyle. So it's both ways. Some patients are more, I want to change my lifestyle, I want to exercise. And I agree with that as well. But then they get a little annoyed with me because I'm on their case. I was like, okay, if we're doing it this way, I'm not going to wait 6 months to see you. I want to see you in a month. I want to see that you're making progress along the way. So it just depends. And I try to meet each patient where they are.
Makes sense.
Yeah, yeah. So let me ask you, do you feel like we as, people of color, do you feel like we are represented well in your profession? How often do you see somebody that looks like us and working side by side with you?
Depends on where you are. Do I think we're completely on level in terms of representation? No. I think that there's a lot of room to grow. And I think that we're at the point where medical schools are realizing that to affect change, people want to have someone that they can relate to in terms of
Hmm.
like getting their medical information or medical knowledge. And I think that we're getting there. I don't think we've reached that point just yet, but
Hmm.
we're on the way.
Yeah,
I'm still very hopeful. I'm seeing more
yeah, yeah,
people of color out there, but I think that there's still some
yeah.
areas to improve.
Well, that's
Gotcha.
good. That's good. I think
Yeah.
that what we're exposed to is important. So,
Mhm.
just there may be a young lady watching now that, can look at you and be like, "Oh, she did it. I can do it too." So, we just want to commend you for the journey because we know it's hard work to even get to where you are. So, kudos for going a distance and actually, being passionate about what you do. We truly
Mhm.
appreciate that. So,
No
hopefully,
problem.
Yeah.
this will encourage somebody to continue to, just really just go after this as well because we do need more
Absolutely.
better
Absolutely.
representation.
Yeah, and
Yes.
I also don't
Absolutely.
mind like taking on mentors as well. Like give advice and things like that. I think that's very important that if you reach a certain level that you're always
Reaching back.
reaching back, try to, help more people follow your steps or do better than you. Like there's
Right.
things that I would have people do differently than what I did. So
Yeah, that makes sense. Now, I want to talk about heart disease because we spoke about hypertension and we
mhm,
spoke about things of that nature. And those are all, I don't know if this is the correct term, cardio type of things that may potentially affect your heart.
mhm.
So let's talk about what is heart disease.
Heart disease is a condition that affects either your heart, your blood vessels, um, basically the heart is the pump of your body, and that's what you need to continue to survive. At least they all work together, but that's a very important piece of it. And so heart disease is something that's going to affect that, whether it's high blood pressure, whether it's like congestive heart failure, where you have or vascular disease, where you have a lot of swelling in your legs. That's all a part of your cardiovascular system.
Gotcha. And with heart disease, what are some of the signs or what are some of the symptoms, I should say, not signs, symptoms that you look for to determine whether it's one sign of heart disease or another? What are some symptoms that somebody can look
one
for?
of our vital being important, is your blood pressure. So no matter where you go, whether it's the hospital, urgent care, your primary care doctor, they're going to check your blood pressure. That's probably going to be one of the first things that they check. So we always keep that at the forefront of our mind. The thing about blood pressure, people don't know it's a problem until it's a problem. It's called a silent killer because you don't have side effects until it's bad. So I encourage people, like if they have like vision changes, if they have headaches, if they have shortness of breath, changes in the way that they urinate or things like that, then they should probably get checked out by a doctor, because that means that your blood pressure is affecting one of those organs that have very tiny vessels, like your eyes, your brain. So yeah, that would be the biggest one. One that people see more often and they are more concerned about is if they have significant shortness of breath, or if they start having a lot of swelling in their legs, or if they gain a lot of weight in a short amount of time. That doesn't seem reasonable. Like 10 pounds in a week, that's not normal. So someone should probably get that looked at to make sure their heart is okay.
Yeah, that's good information. So one of the things that we've kind of witnessed that our listeners have I would say, challenge with is, if you're like me, we grew up in a household where we ate really good. Our foods were seasoned and we ate the portions that we wanted to eat. And so now that as we're getting older, we're realizing that some things have to change. Can you talk a little bit about, as just our generation, so to speak, or our how do we just establish a better nutritional diet?
Oh, I keep it nice and simple. I usually tell my patients when they're talking about diet, I say eat the rainbow, and I don't mean Skittles. I mean eat more of your fruits and vegetables. And I have a little sheet that I give out saying you should probably eat like 2 per color group. Like if you like the color red, eat an apple and maybe something that has red bell peppers in it. And then in terms of the same thing, I say stay away from the white foods. And so when I talk to them, I have them like decipher what I mean by white foods. And that's going to be your salt, hypertension, sugar, diabetes, things that have a lot of starch in it, like potatoes, rice, pasta. Now, those things are good. And I say, don't restrict yourself, because the more you restrict yourself, the more, let me not say don't restrict yourself. Don't withhold those things from yourself, but do it in moderation. Instead of having a complete plate of spaghetti, handful, just a fistful of that white part of the food group, and then the rest can be protein or your fruits and vegetables to add into the diet. Exercise, and I say keep it simple, at least 30 minutes a day.
Okay.
Get your heart rate up, make you sweat. If you're working out and you can hold on a normal conversation like we are, you're probably not doing enough. So just try to pick it up just a little bit, so you're huffing and puffing just a bit.
Yeah. I also noticed that we have a lot more people that are choosing to go vegan. Are there pros and cons to that? What is your expertise in that area? Because I mentioned you said that the rainbow, so you need pretty much everything. So if you're taking one of these elements out, I'm assuming that it has to be replaced somehow.
I feel that people who go vegan, I think it's good because they're getting their fruits and vegetables. And the biggest thing is making sure you're still able to get protein. And people who go vegan the correct way, they do the research and they are able to supplement whatever they might be lacking, or whatever nutrients they might be lacking from not having something like meat as a protein or egg as a protein. Like they find other ways to get that with either beans or So it's more so about the research. So I feel like if you're going to do any lifestyle, do research in it to make sure you're getting the nutrients that you need for your particular body.
That's good.
That makes sense. Yeah, that makes sense. And when you say get your protein, a lot of times because of how we grew up, we always say eat some kind of meat or whatever. But to me, from doing research, I found out that meat is secondhand protein because the animal gets the protein from like a lot of those animals that we eat for protein get it from grass or get it from some
Mm-hmm.
kind of wheat or grain or something else, which is not
Exactly.
another animal. So I think as like you say, if you do your research, there are a lot of things, beans, like you said, being one, there are a lot of heavy protein items that are not meat
Mm-hmm.
based. So I totally agree with you when you say do your research because I actually did it. I watched something on television, documentary, and it broke down how you can get protein, how like elephants or rhinoceros
Mm-hmm.
or those type of animals get protein without having to eat meat. You know what I mean?
Exactly. Yep.
Yeah. Now going into the family history of things.
Mm-hmm.
So let's say I'll use generational. So let's say a grandparent has heart disease. Does that mean it will trickle down to maybe the grandchild or the child or the great grandchild or something like that? Or how does that work?
There could be a predisposition for offspring to offspring. That's so medical for
It's all good. That's why you here.
for kids of parents who have like diabetes or heart disease, for instance,
Mhm.
to get that. But it's also that common dichotomy that we go through of nature versus nurture, right? So
Okay.
like yes, we might have a predisposition to certain things because of our genetics, but at the same time, I tell my patients, you don't that doesn't necessarily mean you're going to have heart disease. If you are making sure you're not eating a lot of fatty foods, your cholesterol is okay, and you're like taking care of your body, then you might not get hypertension. You might not get heart disease.
Mhm.
Same thing like alcoholism, for instance. I'm just throwing that out there. They say that can trickle down from generation to generation. But
Mhm.
at the same time, if a person never drinks, they won't become an alcoholic. So it's nature versus
Gotcha.
nurture.
Gotcha.
Um, so change the environment doesn't necessarily mean you have to get it. Things like breast cancer, um, colon cancer, things like that, genetic disposition, those things are harder to change the outside factors for. That's genetics.
Gotcha.
So
Okay, that makes sense. That makes so basically things you're putting in your body can affect the obviously those type of things
mhm.
as opposed to something that like colon cancer or any kind of cancer outside of like smoking or something like that.
Mhm.
You have no control over. Okay, I got you. That makes sense.
Yeah, yeah. So help us understand some numbers. A lot of us, we go to the doctor, and then the first thing we do after we're admitted is they take our blood pressure, and they give us these numbers back, and most of us don't know what they mean and what they should be. So you can tell us, oh, you're this over that, and we're like, okay. Can you kind of just break down what a healthy number should look like for sugar levels or blood pressure, things of that nature?
Yes. So I start with blood pressure because hypertension tends to be one of the things that affect our community or people of color community more often. Blood pressure should be 120 under 80. So top number 120 or less, bottom number 80 or less. However, there's leniency if you actually have an actual diagnosis of hypertension. Your goal should be, depends on which organization you follow, but per like the JNC 8 guidelines, 140 under over 90 should be what your goal range is. And that's what I strive for. If a patient doesn't have that, then that's we talk, we have conversations.
What do
Gotcha.
those numbers represent? So the 120
Yeah.
represents what, and what does the 80
It's your
represent?
systolic number. So when you're taking a blood pressure, it's pretty much the pressure in your blood vessels, right? And so if you have increased blood pressure in your brain, that can restrict blood flow, causing strokes. If you have increased blood vessels in your eyes, the blurry vision, kidneys, later causes of kidney disease. So the top number is like if you're squeezing the highest number that the blood pressure cuff stop,
Mhm.
you don't hear a sound, then you start to hear a sound. It's all technical.
Mm, interesting.
Yeah.
Yeah. Makes sense. Yeah.
I'm not
Hey,
going to
that's
teach you guys how to do a blood pressure over
over Zoom.
over Zoom. No.
Be sitting
But
there
that's
holding my
what
neck like, that's 115. No, I'm just and if you
So
can't divide and multiply, it's really gonna be tough for you. No, I'm just
Oh,
right.
listen. And
That's why
then
we leave it up to you.
right. That's why we just show up and make the insurance cut the check. So speaking of
but
insurance, how
see, even so
important?
with that, I don't know if it's the teacher in me. I like for
Mhm.
my patients to understand things because I feel like if they understand what's actually happening within their body, they're more inclined to make changes. So I always say, I want you walking out of my office feeling like you understand what's going on, what these numbers actually mean, and what your goal range is. So
Absolutely. That makes sense. Now, in saying that, when we talk about insurance, are there ways, even someone is not insured, to make sure that their health is in order? Are there different maybe like programs or different payment ways of paying things to make sure that they can at least check themselves at least once a year to make sure what their health is on point or off point so they know what to fix?
I try to know the generals of health
Hmm.
insurance in terms of like people who don't have it and where they can go. There
Yes.
are places around the city called FQHCs. And those particular that's like 16th Street Clinic. Here in Aurora, we have Walker's Point. So that is pretty much a clinic that accepts patients who don't have insurance.
Okay.
Um, so I know that patients who don't have it, I typically have them talk to our social worker to try to figure out what they can get. There are usually
Hmm.
some uh, government policies that you could possibly get. Um,
Okay.
it's just hard, like for the resources, and that's one of the things people don't know what resources they have, so they just go long periods without being treated. But
Right. And
we try to find that.
I've heard hospitals are considered like, I don't want to say maybe nonprofit or something like that. So if you just can't pay the bill, you just tell them I can't pay the bill, and they have to get rid of the bill. Is that true? Now I ain't trying to get you in trouble. Don't answer that if you think you're gonna get in trouble. But
I don't think
I was in
that's
the
true.
hospital. I was in
What I
I was in the hospital. I was in the hospital. Obviously, I have insurance, but I'm just speaking. I would have a conversation with a doctor, and she was telling me, the young lady was telling me that there is a loophole that the average person doesn't know about where they can actually get rid of their bill. She was explaining it to me, but because I got insurance, I was half listening. You know what I'm saying? But I thought it was. I never heard anything like that. Back in the day when I didn't have insurance, I wish I'd have known about it because I would have pulled whatever that move was called. You know what I'm saying? So I was like, that's extremely interesting. But we do know we have Walker's Point, and then what was the other location you said?
there's 16th Street Clinic all around the city. It's not just
16th
on
Street.
16th Street, but there are many clinics throughout the city. Those
Okay,
are the two
gotcha.
that I'm aware of.
Okay, well,
In
we want to
terms
give
of
them
what
that
you're
information.
talking about in terms of the insurance thing, I know if you are in an emergency, hospitals definitely can't turn you away.
Okay,
Um, but in terms of like insurance, I'm not really familiar with
familiar. Okay.
any loopholes.
I just figured I need to ask the doctor just in case. I might need to pull that move one time in the late,
But for
in the
me, I
past.
also try not to know what people's insurance are, whether they're insured or not. And that's only because I don't want people to think that they're being treated differently based on
Differently,
what they
yes,
have. I want everyone to
understood.
feel like they're getting the
E-
best care.
Exactly,
So.
understood. That makes sense. Yeah, that makes total sense. Go ahead, Rio.
I'm sorry. I think my mic was muted. Here we
Yeah, you
go.
was muted.
No.
Yeah, you were. Yeah, I saw you talking, but I didn't hear you. So yeah, it's all good.
Yeah. So, what would you say is the leading cause of death for African American people, or what's some of those things that really plague our community, and why?
Number one, you guys brought it up, heart disease. From my understanding, heart disease is the number one cause. And there's a lot of things that can lead to heart disease, like lifestyle changes, obesity, for one. Um, and then, like, if you're taking a deeper dive down that rabbit hole, it could be the social determinants of health. So, just like, what do people have access to? Do they have access to quality food? Do they know how to make the right food? Things cost money. So, do they have money for insurance, like we just talked about? Can they pay their co-pays? Can they pay for their medicine? So all of these things we need to take into consideration. Like I'm a firm believer of like not making excuses, making ways to get things done.
Mhm.
And make sure that you're working with like whoever you can to get those things done. So for me, it's the team, it's the social workers, my MAs, nurses, like reaching out, calling people to see what we can do. Our community health workers, for instance, at over at my clinic, seeing what we can do to give people the resources that they need. So heart disease is number one, cancer, I would say number two.
Mm.
Three fluctuates for me.
Okay,
Gotcha.
yeah, that makes
Yeah.
sense. That makes sense. So basically, good heart health helps everything else. That's
Mhm.
where it flows from. That good heart health, which makes sense because of what the muscle does. So that makes a lot of sense. As far as the family structure and and since you deal with the entire family, who do you say dictates the health of the family? Is it the mom, the dad, the like what person in the family, or does it vary depending on? I mean, obviously it vary, but overall, what percentage of is it the father, the mother, the grandmother, the grandfather? What do you think is the one that dictates the health of the family?
My opinion,
Yes.
just my opinion, and it means nothing in the grand scheme of things, but just I would say the mom of the family, because the
Okay.
mom is looking at the kids, the mom is forcing the dad to get in. The dad doesn't want to come to the doctor's office, so the mom's like, "You need to go to the doctor's office. Something's not right." So um, I feel like they play an important role in the family, in the healthcare of the family.
That makes
Yeah.
sense. And women are much more detailed than men anyway. So that to me that makes a lot more sense.
You know, or they'll say like, "What was that thing that I saw in your face?" And
Right,
the
right.
husband might not know.
Not even know.
He's like,
Yeah,
"Oh,
yeah,
you need to get that checked out." So I get a
yeah.
lot
Yeah.
of that.
Yeah, that's
Yeah.
true.
How does okay, so I know you deal with a lot of different patients, so you see, I'm sure, everything.
Mhm.
And how does mental health play a part in the healthcare and the things that you have to kind of deal with? And have you had to develop relationships with therapists? You know, when does it go beyond just you seeing them for a visit and understanding that it's something more going on here than what the eye can see, the physical health?
Sometimes I might take a little extra time with that particular patient, and I think that that's important on a specific visit. But at the same time, if I know that they're going through things, I don't want them to feel like my doctor kind of finished the visit and let me out to the wind. So I have them come back more frequently.
Mm.
Um, I have a list of coping mechanisms that I give out. I try to make them feel comfortable with the therapist. Some people are still not comfortable with therapists. I let them know that you can't be Superman or Superwoman all the time. Like you might need support yourself. So I try to
Right.
encourage them to know that that's okay to feel that way. And if you need a therapist, that is perfectly okay. Try to break the stigma like a therapist means that if you choose a therapist, that means you're weak. Um, and then I just try to be that bridge until they're able to get over into like our behavioral health programs. Um, I do think it's very important, but I also think that one of the good things of social media is that is making it more
Acceptable.
accessible, and
Yes.
it's making it more norm, making it
Mm.
Right.
more normal. So people aren't as it's not as taboo to say, "Oh, I'm talking to a therapist," or "My mental health is," or "I feel emotionally hijacked," or things like that. People are able to express themselves a little bit more, which I think is very important because when you're
Yeah.
stressed out
Yeah.
or going through mental health problems, your body's releasing
Hmm.
hormones,
Hmm.
cortisol, that can
Hmm.
cause certain things, physical manifestations that are not good for you. So
Yeah.
I think that
Yeah.
it's important that it's getting better, it's improving. So
Yeah, and that's just one aspect of the people that you deal with. And like I said, you deal with people of all types. So what about people with disabilities? Let's say we have some families that have some disabled children, or family members that can't really express the needs. So how do you deal? Do you have to have extra training? Are you prepared or equipped to deal with people with disabilities? And how does that what does that look like when someone of that nature comes in?
Depends on the disability and like knowing where your resources lie. So, for instance, knowing like how do I say this? Physical disabilities. I know there's physical therapy. You can go to that. I try to learn different types of therapy that I can do in office, or give them strategies to leave out of my office with, whether or like knowing the resources or where in the city they can go to get wheelchairs. If it's a mental disability, knowing where they can go in terms of psychiatry, and different, just knowing the resources. And also, as a family medicine doctor, you have to know what you can do yourself and the things that you need to refer out to a specialist. So I'm prepared to do a lot of things, but I know my limitations, and I let the patients know that and say, okay, this is where we need to reach out to someone else to kind of help us out to get what we need.
Yeah, I think that's key, is allowing a specialist to, depend on what the area is, let them take over. And that's one thing I do admire about the medical field, is that they have a specialist for everything. If you got earache, they got an ear note, throat, or whatever it's called. I've been to one of those before. You know what I'm saying? Where they look at your whole whatever that's So that's one thing I do like about it, because if other things in our lives had that, where instead of somebody acting like they know everything and there's a specialist for that, let's say you have a such and such, go to this specialist. Just like you don't have a plumber fix your car. You know what I'm saying? You don't have a barber fix your teeth. So I think that makes sense when it comes to that's what I like about the medical field. They refer it out. If it's your foot, they'll send you to a podiatrist. I think I said that correct. Somebody, so I think that's an amazing thing, the way they have that broken down. And we need to take advantage of those different specialists, because a lot of times we go to the wrong kind of doctor for something when we really should have been to a cardiologist, and we went to a neurosurgeon or something. You know what I mean? So I think that's something that we also need to know about, is what type of doctor you may need depending on what your need is.
And I think that's one of the key things about being a primary care doctor, whether you choose family medicine or internal medicine. We're like the hub of a spoke if you have lots of specialists. So we all read the chart, but it's your primary care doctor to like get the bigger picture. And sometimes people need that person to explain exactly what's going on with everyone else that they're seeing. So I think it's very key that everyone has a primary care specialist, because if you specifically don't know what kind of doctor you need, they probably are trained to tell you which one you probably need in a particular area.
Yeah,
perfect.
Yeah.
Perfect.
Well, Dr. Taylor-Coleman, we are truly honored just to have you. It's been a wonderful experience. Thank you for just coming and bringing your supply and sharing the things that you've worked so very hard to obtain, and just taking out a moment to share with our community. We truly appreciate you, and we hope to definitely talk to you again in the future. And just continue to keep up the good work. We appreciate you. And
no problem.
We know you got some lives to save, so we thank you for the time you take. We hope nobody,
I didn't get paid yet, so I'm
okay, cool. I'll say we hope it wasn't no cold
red
reds while you were sitting here talking to us. You know what I mean? We wanted to make sure that we got
I'm
some
not on
knowledge from the
call
book.
for that tonight.
Okay, there we go. There we go. As long as we ain't kill nobody, we cool. We just want to make sure
We're okay.
we got this knowledge. But thank you so much for your time. We really, really appreciate you, and look forward to having you again soon.
Absolutely. Thank you, guys. This is very important.
Oh, no problem. No problem. So our listeners, we just want to encourage men everywhere to, take control of your health. And for families, just teach your young boys healthy habits throughout childhood. Chad and I are truly grateful that you guys tuned in. And we hope and pray that something that was said in this podcast will impact your health and someone you loves health in a positive way. So until next time, we appreciate you guys, and we'll talk to you soon. God bless.
Peace.